I'm just reflecting on something that you have said in the NAT5 report, indeed, that actually in the past, anaesthetists have focused on the issue of preventing pain as a primary target of general anaesthesia, but NAT5 seems to be suggesting that maybe it's not that at all, but that the primary target is the avoidance of awake paralysis.
Yes.
And I think that's a point that's very well taken, because obviously in my own clinical practice I'm seeing patients who have been traumatized largely because of the effects of paralysis rather than pain. We had a very interesting conversation last night around the issue of concerning what is the ideal endpoint for a general anaesthetic if you're wanting to avoid psychological disturbance following general anaesthesia. And I was talking about the point at which a patient is able to make catastrophic attributions to the predicament they think they are in.
Yes.
Because it's that process which actually causes psychological trauma. So we were thinking about whether one could correlate perhaps the point at which one loses the capacity to develop constructions of external stimuli, the predicament that the patient is in, whether that could be correlated with maybe one of these 4 or 5 stages of isolated forearm response.
I thought that was a very interesting conversation, and reflecting on that, I think that's close to what I think the situation probably is, in that we have the awake condition where we are rationalizing, explaining, and use the word appraisal or hypothesizing, creating mental models for the world around us. And even in sedation, I think we're doing that.
Yes.
We're just accepting of the situation.
Sure.
We don't have that anxiety element, but we're still able to make sense of the world around us in a pain-free, non-anxious way. And the point about this other state, which I've loosely called dysanesthesia, is that state where, yes, we have information that's coming in, so we haven't given such a dose as to block sensory input, but we're unable to, or unwilling, or undesirous of making sense of it. We're just distant from it, and we're unconcerned by it. And therefore we don't formulate these wild ideas, because we're in our own world, as it were,
of course,
doing whatever we're doing.
The other approach to this, of course, is to provide training or substantial information. Some might say this is completely unrealistic, because really you want to train them as an anaesthetist, so they know exactly what's going on. So that we moderate, or we mould their expectations about what they could experience. But given the fact that we're talking about fairly low probability instance, many of our colleagues would argue, why upset many people for whom this isn't going to be a problem? Well, why go to all this trouble of explaining the nature of general anaesthesia?
Well, I think in a sense it is down to what we think the thing is. So if you go to a patient, you say, look, you're not going to remember this period at all. You're going to have no experience. It's going to be blank. And if it isn't blank, then obviously there's catastrophe, and there's catastrophic interpretations. But if you say to people, look, actually we know anaesthesia is a state where, for many, it is, you will experience things, you just won't make sense of it. You'll see flashes of light, you'll see sounds, but don't worry, that's part of the deal, as it were. And if they do experience that, well, fine, that they know that's what it is, and they're not distressed or in pain, and etc. And they've come to terms with it. And for those who don't, they're not going to complain, I didn't hear the flash, I didn't see the flash of light, or I didn't hear the loud bang. So I think it is an attitudinal thing. Of course, coming back to this state, in between this anaesthesia or whatever, where people aren't able to appraise things around them. The question is, what's the behavioural correlation of that? Could it be that some of these limited isolated forearm responses, where they're only responding to command or something, that actually signifies their inability to appraise properly, but retains a sense of core response? So that might need reassessing if what you say turns out to be true, which I think it might well be.